Okay. Okay, so welcome everybody. This is a Bill Like a Boss presentation. I'm Kim Tolson. I'm hosting this. Bill Like a Boss is a membership group that I have that helps therapists and virtual assistants learn how to bill in their practices. We're like a support community. And Annie and Donna are the billers of Bill Like a Boss. They're our expert billers, resident billers, whatever you want to call them. So we decided that there was a need for these really specialty topics. So that's how this webinar came about. And we have plans for a lot more of these really specialty webinars. So if you have ideas on topics that you're really struggling with in your practices, let us know, because we're really excited about this new webinar series we started. So I'm going to turn it over to Annie and Donna, let them introduce themselves. I'm going to mute myself. If you have any problems, feel free to message me directly and I'll try to help you behind the scenes. Okay.
Thanks, Kim. So, and like Kim said, if you guys do have any questions, if you just put them in the chat, because we can only see Kim right now in our corner. So if you have anything, just let us know. But I want to go ahead and start, and I am actually Donna Haswell, and I'm a licensed clinical social worker. And this is Annie Day, and we're starting the Incident to Billing Masterclass. So we'll go ahead and start just so that you know a little bit about us. So I actually started a group practice called A New Dawn, A New Beginning about 6 years ago. And when I started that practice, it was really just me, but I had no idea that I was going to be hiring interns and hiring other therapists and like trying to figure out my billing. I knew I just kind of wanted to get out of community mental health and try to figure out how to do this on my own. So after doing that for a few years, I decided that I needed to learn a little bit more, because I did not have the best experiences trying to figure out things. And I learned that there's just not a lot of knowledge. Like, it's not something that we're taught in school. It's not something that is easily available to us. And so about 2 years ago, Annie and I decided, you know, I think that we need to help other therapists that are really trying to figure this out on their own, or just want to know. Like, you know, I remember as an intern, I had no idea what the requirements or anything were, and I was really dependent on my supervisor to know those things. And then on one hand, it worked out great. On another hand, one of my supervisors didn't know about logging hours, and so I lost hours. And so I think from any perspective, whether it's coming from the supervisor or coming from the intern, like, it's really good that we understand and learn what our roles, what our responsibilities are, and also just know for our own liability purposes. I also know that coming up through community mental health, there was a lot of things that I thought were normal. That was the rule, that was the guideline. And as I got into this, I realized that either things changed because I was going into a private practice, or B, that was just how they always did it, but it wasn't always the right way to do it. So I'm hoping that with some of this today, we can answer some of those questions and give you guys just kind of like a baseline of like where to start and how to get some of this information that you might really need. So you want to talk about our contact?
Yeah, so with our virtual assistant side, excuse me, with A New Dawn, A New Beginning, the phone number is a direct line that will get you to one of us. So feel free to call if you have any questions, or if you are interested in services. You know, you can leave a voicemail. That is a direct email as well, and then that is our website.
So also feel free to check out our website, see what services we offer, see if there's any guides or anything that we can help you along the way. Or like Annie said, feel free to reach out to us, send a message. Hopefully, yeah, if we don't know the answer, then we'll find the answer, and then that just helps us learn even more. So
yeah, I would say that's probably 90% of our learning, are going and finding answers.
Yeah. Okay, so just really quick, kind of the things that we've been seeing and hearing, and some of the questions that we're getting that we kind of want to cover today, so you guys can see. One of the things is, first of all, what is incident to billing? So we're going to talk about what is that, and some of the other words that you might hear along the way, because sometimes that can be confusing. So just what is it? What are the requirements? Like, who is allowed to do it? Who's not allowed to do it? How do I know where to find those requirements? What are the supervisor requirements? So like, what am I in charge of? So when it comes to having some of my own interns, what do I want to know is really important. And is there a difference between associates, interns? What's that look like? What does that even mean? Is there certain types of interns I can't accept? And how does that look? And then of course, we're gonna talk about how do you bill that? Because that's important. We wanna make sure that we're billing it correctly so that not only that we're getting paid, but our interns are getting paid as well. Which insurance companies allow it? And then we're gonna give you kind of a step-by-step instruction on like how to bill this. Does the intern need to be registered? And of course, like we wanted to throw in what does the intern and the supervisor perspective, like what does that look like? What should we expect? Like, what kind of questions should we be asking? So that's just kind of a little bit of where we're gonna head with this today.
So incident to billing, commonly interchanged with supervisory billing, is a way of billing outpatient services provided by a non-physician provider. So basically, as an intern providing services under a supervisor, providing those for our, mental health, those therapy sessions. There are quite a few requirements that change with different insurance companies in different states, and we'll go over that in a little bit. The one thing that stays pretty consistent is that you must have a documented continuum of oversight with that supervising provider. That can look a couple of different ways. That can be, during those hours of supervision, documentation review, questions, that intern brings to the supervisor about specific clients or about specific, issues that come up. It can also be some of those brief kind of face-to-face interactions with the intern, with the supervising provider, and then with that client.
So one thing I also want to add is sometimes you will notice that different insurance companies are going to ask a little bit about, like they're going to call these different things. Like they'll call them maybe registered interns, supervisory billing, they'll call it incident to billing. We've seen associate billing. So just know that if you call and you're asking for certain requirements or you're asking for certain things and they don't understand what you're asking, sometimes we just need to change our terminology and explain that that we have a licensed provider that is overseeing a non-licensed intern. And so sometimes when we can explain it like that, we get a little bit more clarity when talking to insurance companies.
And I mean, along with that, just realizing that as each insurance company has different guidelines, each insurance company also has different terminology that they're going to use. So like Donna said, if you can kind of explain the situation that you're asking about, you're that much more, successful in getting someone who can try to help answer your question and guide you in the right way.
Yes. And the other thing I also kind of want to add to that too is making sure that sometimes when we call the insurance companies, we don't know who to call and who to ask for. And so sometimes we do want to call billing. However, a lot of times we also want to talk to our rep. And so if you call the billing and they're like, because they will tell you, we can't give you codes, we can't tell you this, we can't tell you that. If they're giving that to you, you want to make sure you know who your rep is when you're signing your contracts, because that's the person that you can go to basically any question, and they should direct you to who you should go to. So I think that is like a huge thing that we learned when you're calling insurance companies and you're not getting a lot of help or you don't know which department to call, definitely reach out to your rep. So as a supervisor, one of the things that we want to make sure is that, of course, we want to make sure that we are the licensed ones. So we want to make sure that we're licensed in that state along with that insurance company. So I know there's been some questions about different state lines. And I know that they're working on different, like having different state lines, a compact where you can get licensed in several states. So you want to make sure that wherever you are supervising, that is the state that you are licensed in. One of the biggest things is also making sure that you understand the scope and the practice of your intern. So, which I did not know this till recently, about 2 years ago. I can also have an intern that is a psych nurse practitioner. Now, when we were talking about definitions, like this is the one where I kind of wanted to pause for a minute and talk about that. So an intern that is still in school. So if they are still in school, so whether they are an MSW or bachelor's level, I cannot bill for those services. I need them to actually have graduated. So one of the things that I did learn is that, for instance, a psych NP, I can do her supervision while she's in school, but I cannot bill for that. And when she's out of school, I cannot supervise her. So I like to use that example because there's a lot of things that can still happen while they're still in school that we can supervise and that we can manage. However, once they're out of school and they're working on their licensure, make sure it's in your scope. And that can definitely vary state by state. So for example, in Florida, where we're located, I cannot necessarily oversee an LMH. Somebody's trying to go for their LMHC because I'm an LCSW. There is certain things that I can go around to do that. And that would mean I'd have to take additional classes and have a couple other things added on for me to be able to supervise an LMHC. So you also want to make sure that as a supervisor, number one, is it in your scope? Is it the same field that you're in? Are they working towards the same licensure that you're working towards? If you have a question or you're concerned about it, you can also reach out to the board and they will actually send you a detailed criteria for every scope that says, hey, this is what meets the criteria for you to be able to supervise them. So that's the other thing that you want to make sure of.
Yeah. Also within the supervisory role, as far as insurance is concerned, you also need to make sure that any like your CAQH, any documentation that you have that has to be updated with that insurance company is done on time. You need to make sure it's submitted and that they have accepted it. We've seen a lot of like correspondence come back that your CAQH hasn't been attested. Make sure that all of those documents are uploaded in there and that is attested. And just make sure, you know, that you, as those dates are coming up, that you're aware of those, because not only does that now impact you as the, you know, supervisor who was licensed with that insurance company, but it's also going to affect those interns as well.
Yes. So the other thing is as a supervisor, I need to make sure that I'm going to look at their treatment plans. So their treatment plans, their notes, all of those things have to be reviewed and have to be signed. So as a supervisor, the other part is to understand that this can be time consuming. So you want to make sure that you're taking out time to sit down and be able to read all of these things and connect them. So essentially you're almost doing an audit. Like you're checking behind them consistently to make sure that they're meeting the criteria that's specified for the notes per the insurance company. And I think sometimes whenever we have a lot of interns, that can be very overwhelming. So that's something to definitely think about when you're thinking about, as a supervisor, how many interns do I want to take? What do I want this to look like? And do I have time? Like, do I have time to sit down and read all of these forms and give feedback? Most insurance companies actually physically want the supervisor signature at the bottom. So you're not just looking over them, like you're literally reading them and you're signing behind them. You also want to make sure that if it's your intern that you're supervising in the agency, that they're actually somehow tied to that agency. So we want to make sure like they're a W-2 employee, they're an independent contractor. We want to make sure that they're actually working for us. So if, for example, I am working for agency B, Annie's working for agency C, I am not going to let Annie bill under me for agency C unless I am going to go work for her agency. So you want to make sure that you and your intern are working in the same place. The supervisor needs to be able to be easily accessible. So COVID has kind of changed a lot of how we look at these things. So more recently, and this keeps going back and forth, interns could see telehealth. However, they've switched it back to interns could see telehealth if there's a supervisor on site. And then there's another switchback that's like interns could see telehealth. No, they couldn't see telehealth. And so I think we're back to interns can see telehealth if they are an agency, but not a private practice. So you really have to check your state boards, because like I said, this is like keeps flopping back and forth over the last year about who can and who can't and where the supervisor has to be. For the most part, supervisors have to be readily available wherever the intern is at. And again, just make sure that you're in the same scope of practice when you're signing off, that your state says, hey, in LCSW you can sign off on a LMHC intern. Like, just make sure that those follow your state. Some states are fine with that. Some states are not.
So I know there are a lot of questions about who this actually covers, and these, requirements here are a lot of what we saw with the insurance companies. States may have different guidelines, especially schools, when it comes to, like Donna was talking about earlier, who can, like she could provide supervision for a nurse practitioner, but not when it came to billing. So if you have a doctorate or master's level clinical psychologist, the doctors or master's level clinical social workers, and the clinical psychiatric nurse practitioners. So when we looked at the insurance, like the insurance lingo and what they were willing to reimburse for, this is what shows up in their contracts.
So, and remember, when we're billing, as the supervisor, that is who the insurance company is going to see as billing. Mm-hmm. So they're not necessarily going to see Annie, they're going to see Donna's name on there. So think of that when you're thinking about taking on an intern and supervising, that yes, if you fall in these categories, we can supervise, but it's also our name that's going on to that billing. So we actually have a consent form that we will send out to you afterwards. But the biggest thing is that we wanted to make sure that we all understand that we do have to inform the clients that they are seeing an intern. So for the main points of the consent form, we want to make sure that we identify who is the intern. Mm-hmm. So have that intern's name listed, have their degree, have what they're working on. We also want to make sure that the clients understand that a supervisor actually will be reading their notes. I know sometimes we just kind of say, well, I have a supervisor and I check in with them and they do supervision with me and we staff cases. And I think that's great to say, but we also need to add on the fact that there is another individual for confidentiality purposes that's actually going to be reading and checking in on the progress. Mm-hmm. So I also know for me as a supervisor, we have to do brief face-to-faces for certain insurances. And what that means is that after my intern is seeing a client and they have a diagnosis, I will go in there and I will do just a brief assessment to make sure that I agree with his or her diagnosis. But I'm also going to ask, do you have any questions or do you have any concerns? And also make them aware that I'm also the supervisor. So if there's ever any problem or they have a concern or they maybe just feel like they're not getting what they need, they have met me, they have seen me, they know how to contact me. That's something that can be provided on the consent form. So for my interns, they actually go over that as well with the client. And if I can't, for some whatever reason, meet them that day, I do try to meet them before they do their treatment plan to make sure that they know how to contact me and know that I am the supervising clinician.
Yeah, and I mean, I think on paper, it's, you go over it, you read it, they know that someone else is, but during that brief face-to-face, when you're physically seeing that person, like Donna said, you put a name to the face. And, if for some reason I know, like if anything happens and like that client is out in the waiting area or, they're back there getting checked in with the receptionist, it just kind of makes it a little more personable for them. Like, oh, hey, I can say hey to them. I can check in with them. It reinforces that relationship also with the client, the supervisor, should, anything happen that they need to follow up on.
Yeah. And a lot of insurance companies will actually require, they call it like a brief mental status exam. They'll call it a brief assessment. They'll call it a face-to-face. So those are some terms that you want to be familiar with. And basically what they're kind of aiming for is they want that supervising clinician to technically make that diagnosis. They really want you to go in there and kind of review what your intern has done, but ultimately make that diagnosis. So I don't know of very few that don't require some sort of like a brief intervention so that you can actually make that diagnosis.
So a lot of this, there's been a lot of, conversations and information, and Donna went over a little bit of this in the beginning. As far as like who qualifies for this. And so really, when we think associates for an LCSW, it may mean an associate's level student, which may mean, a bachelor's level student, that graduate level student while they're still in school. Basically for the insurance companies, one of the things that we found kind of universally was they were calling an associate anyone who did not meet licensing requirements.
Yes.
So just know that your definition of some of these terms are not going to be exactly what the insurance companies are going to say. And so asking those very specific questions, like giving those examples, I have someone who has graduated, they have their registered intern status. What can they provide? What can we bill? Those are going to get you those best answered questions. And then to get that in writing, kind of is like a guarantee for you. We're going to show you in a couple of slides the differences in some of these insurance companies and what they allow. But just know that even some of your national Cigna and Aetna and United, things like that, do not have nationally recognized policies.
Yes.
They are definitely, some are even region by region, some are state by state. I think United told us it's literally a case by case scenario. So just because you kind of get this, in one area does not mean that it's universally or nationally recognized. That insurance representative, those reps that you can get in your provider relations department are going to be your best answers for making sure that you are covered within your specific situation in your area with that specific insurance company.
Yes. And one thing that I do want to add that has come up with us particularly is, so when I think of my intern and let's say they get licensed in a month, what now happens? Mm-hmm. And so that is something that we had to run into. And so the best advice that we have been given at this point is to ask the insurance company for a grace period, or they could move it along faster and put them on your roster. But for the most part, most insurance companies are not going to want a licensed individual under another licensed individual. So if for whatever reason Annie becomes licensed tomorrow, I do want to make sure that I have notified the insurance companies to say, okay, what is our grace period? Like, how long do we have this to get her credentialed with you? So I don't have a clawback. So, because there's a good chance if they're auditing her and all of a sudden she's signing her notes as LMHC, and she was just a registered intern the day before and they weren't notified, that there's a good chance that they could call that money back, because at that point she's not technically a registered intern. She's now changed into a licensed provider. So I know that that's something that we've been asked a lot, and that is the answer that we get from the insurance companies, is to definitely ask for that grace period, and or ask them, she's already seen these clients, how can we go ahead and move along?
Yeah, and a lot of them will give you that grace period. They'll just give you different determinations on how that looks. Like some will say, we've got you on our list of providers. Your credentialing is not finished yet. So technically you don't meet the criteria for credentialing with our company. So continue billing as you have. Some will say, we'll backdate your contract to cover these appointments. You now need to sign because you are licensed. We have your information. It's on file with our insurance company. So you definitely just want to make sure that whatever guidelines they're placed in that grace period, that you're following those, and to make sure that you have those reference numbers. If you can get any of that in writing, to make sure that you have documentation if an audit or if a question ever arises.
And note, sometimes that may mean holding the billing. So we've had insurance companies that said, yes, she's licensed and we're okay with that. We feel like she'll be credentialed. We'll backdate the contract, hold those claims. And so we will hold them until they give us the okay to go ahead and process them. We've also processed them, and then when they were denied, called back and said, can you reprocess them?
Yeah.
So we've done both ways. I think it's kind of depends on how your agency or practice works. But I think the biggest part is know that it's not a one size fit all, and every insurance company has different requirements. So you definitely want to reach out to your representative and make sure before that time comes how they want you to handle that.
So most of the insurance companies that allow the incident to billing or supervisory billing only want the supervising clinician's information on the claims. So they want that on that line for the date of service. They want that at the bottom. And then obviously your organization's information in your practice location. They do advise that all of the information for that rendering provider, for that intern, be kept in your internal record system. So if you have an EHR, make sure you have that. If you keep their documentation, you have their license information, you have their registered intern status, their liability, insurance information. All of that should be kept internally so that if there is a question, you're readily available to provide that. Some insurances require a specific modifier for that, and we'll show you that on a few slides. So if this is what you're looking for, if this is what you're kind of leaning towards, I would almost make an intern billing cheat sheet because it is so different and some of these are so spread out that you can kind of make sure that all of the claims that you're submitting are to that insurance company's specifications. That way you're on your end trying to eliminate timelines, you're trying to eliminate clawbacks, you're trying to eliminate, any sort of error that they could kind of perceive with that claim. Also, and this was, it was kind of self-explanatory, but I had not really thought about it until, I think it was Cigna explained that, like, just as a regular claim, those clients are going to receive that EOB. So if I was the intern and I was seeing, John Smith and I, went through all of this, he is going to get an EOB stating all of his claims have been billed under Donna Haswell. So just to, make sure that all of those, notices and all of that confidentiality practices are set from the beginning. That way, just kind of how that relationship works, how that timeline is going to work, is understood by everyone in the process.
And I think, so I will say, because Annie does the majority of our billing for us right now. So when I go into Annie's little cheat sheets, she really does. So for every insurance company, and I think that's always just kind of a good thing. Like for every insurance company, as you're credentialing and as you're working on your billing, just, like an Excel sheet with who is a good person, like who's your rep, who's a good contact number, list those modifiers. And then just kind of have like the important things, like this company does do a face-to-face, this company doesn't really mind if the supervisor's sees them or checks in on them. Just keep that kind of cheat sheet for yourself because it gets really overwhelming and it changes so much. So I know between Annie and I, we get tons of emails every day from insurance companies about a new policy or a new resource or a new, and so a lot of times we're trying to read through that to see what is ours, like what is something that we really need to pay attention to. But if you have those cheat sheets, that's really easy just to kind of go in there, update that, and you're staying on top of it. Otherwise it just gets really overwhelming.
And it can be really overwhelming having one intern. But if you are, kind of looking at, I have a group practice, I have, multiple interns, we're billing multiple insurances, I could see easily how that could be overwhelming.
And if you're the supervisor and you're trying to bill, it's a whole lot easier to have that cheat sheet to just kind of go in there and look at that.
So some of these insurances, I want to look at Blue Cross Blue Shield first, just because
they're a great example.
They are. They are a great example of the very same insurance across state lines having multiple different policies. So Highmark Blue Cross Blue Shield, they allow incident to billing. I know they cover Pennsylvania. I believe they cover more states than that, but they require the SA modifier. So also with Highmark, knowing what credentials are allowed to bill that. There is a Blue Cross Blue Shield that doesn't allow for licensed clinical social workers. And I cannot remember the state. I tried to go back and find it, but they would allow a licensed clinical social worker to bill incident to billing. So they would have to bill under a supervisor. Blue Cross Blue Shield of Illinois, you have to provide documentation that they're actively working toward licensure. And I know a lot of states lately have kind of changed some of their requirements on that. You know, so it's not just like, oh, I'm an intern, eventually I'm going to get my license. That's an ongoing process. Blue Cross Blue Shield of Minnesota requires a U7 modifier. Michigan has different modifiers for different credentials. A limited licensed professional counselor is the HO, the LMSW is AJ. So just really knowing, I mean, to me, that was a perfect example of kind of looking through there and trying to figure out, I mean, basically, it was almost like state by state.
And region by region.
Yes. Blue Cross Blue Shield of Hawaii, let's call them. Let's call Alaska. Let's call California. So to me, they're a good example of, like, just because I know, you know, I know this policy in this state, I'm going to apply it to the other state. Those do not cross state lines. Aetna and Cigna are actually pretty easy as far as the billing goes. I'm not sure how the credentialing process goes to get licensed with those. But they basically just require that you keep your information for that intern internally, and that you bill under the supervisor.
Yeah. I think Cigna was like, we just don't need to know.
Yeah.
Just make sure you keep track.
Yep. It's a 3-minute phone call. Yep. Sure. I was okay. Medicaid is also state by state. Medicaid, and as far as Florida goes, they are the insurance that require those face-to-faces.
Yes.
So that brief 10 to 15 minute actual face-to-face with that client and the supervisor.
Yes.
And those are needed with those treatment plans. Before a treatment plan can be done and kind of sent in with that diagnosis, you know, and those interventions attached to that client, that has to be done.
Yes. And I think, you know, I like to use Blue Cross Blue Shield's example because I know most of us are familiar with it. And I see a lot of times people ask questions and they're like, you know, well, in this state, like LCSWs can't do this. And, you know, LMHCs can't do that. And so I think it's important also, make sure you're asking the right questions when you call the insurance company. So, for example, I would literally say, what modifier do I need to use? And is it per credential? Is it per supervisor? Like, what does that claim need to look like? And absolutely ask them to be specific. Because a lot of times they just kind of like want to give us a vague or generic answer, but we need to know the specifics about it. And then in regards to your, like, the process, so coming again from the supervisor's perspective, I'm going to ask my rep, my insurance rep. So there's some United Healthcare that, for instance, can have interns and I can supervise them. And there's not a whole lot that I have to do. But then there is some plans that's like, you have to be an agency. So I'm going to make sure that I reach out to that rep and I'm going to ask, number one, do I have, like, can it be a group practice? Does it have to be a community mental health? Can it be a private practice? Then the other question that I want to ask is, what do you need me to submit to you? Do you need my license, their license? Like, and how do you want that? So we also want to make, you know, we've been talking about audits and trying to do all that fun stuff. That's always a blast. But we've been looking at that. And, you know, the biggest thing is to remember, insurance companies want it to be easy, simple, and pretty. So we want to make sure that when we are calling, make yourself a cheat sheet. Go ahead and figure out what are the questions that you want to ask and just kind of rattle through there asking those questions. And the other part is so when I ask them, what do you want? If you're going to audit me, what is it in the audit that you're going to look for? Like, that is what I'm really trying to figure out. And the other part is, again, if it's, does the supervisor need to physically see each client, or can they just sign it?
Yeah, I know some insurances, you know, kind of set it up to where some of those intakes and those treatment plans are done collaboratively.
Yes.
You know, that can be done with a supervisor and intern together. The treatment plan is set up. Everybody's aware. Those are very clear expectations that are set from the beginning. And then once those actually therapeutic sessions start, that's when the intern kind of like takes the lead with that and is solo.
Yes.
I have a star beside United because they they gave a lot of information. None of it was really promising as far as incident to billing. So in 2020, they actually redacted a lot of their policies allowing incident to billing. They make it very difficult to get the type of contract needed, which is an agency contract, to allow for incident to billing, to allow interns to bill their insurance. When you go to their portal, it basically says you have to meet just a few requirements to apply, and it's not that many. You have to have your liability insurance coverage, and then you have to either be a rural mental health agency, a community mental health agency. There's two more.
There's one that you had to have so many people, like five or more.
And then one was a portion federally funded, maybe. But there's basically four, and then your liability insurance. That allows you to apply. So once you finish that application, within 30 days, they get back to you and will let you know from that kind of what area they are going to assign you. And unless they assign you as an agency, which is not very likely, you cannot bill incident to billing. So even if you meet the requirements, you have the certain number of people, you meet the scope of practice, you have your liability insurance, it's very, very rare in 2022 that you would meet the agency application on their end for them to allow you to do incident to billing. A lot of some of the community and the nonprofits that are tied to teaching universities or teaching hospitals get that approval.
And again, I think that speaks volumes to making sure that when you are calling, that you're getting this feedback on what is the criteria, what is this going to look like? Because again, it has changed so much. And I think for us, because I had an intern pre-COVID, and so some of the rules and regulations for her are not the same as my interns that I have right now. And so that was kind of also a thing to keep in mind, is that even though we get 30,000 emails from them, we definitely want to check them, because at any time they can change what this really looks like.
So when you,
The fun part.
yes. Yes, when it is allowed. So once you have, those contracts, you have your fee schedules, you have your documentation stating that it is allowed. You need to make sure that the claims reflect those supervising clinicians' credentials. Basically, if I'm looking at a claim, I should not be able to tell that Donna saw this client or Donna's intern saw this client. It is going to reflect her. Make sure your place of service is correct. I know with the new place of service 10 and 02, and a lot of those changes, you need to make sure that those place of services are correct for what those insurance companies are asking for. And then, like I was on that previous slide, make sure that if a modifier is required to indicate that incident to billing, that you have that included. And
make sure place of service is where your intern saw the client. So I think that's a big thing to remember too, is that we don't necessarily want where I saw them, necessarily where the intern saw them.
Right.
And then again, make sure that you're on the supervisor standpoint, make sure that your stuff is signed. Like if you need to, so for instance, one of the things that we've kind of ran into and had to adjust was, one of the questions was when it is sick. I know a lot of the insurance companies have times of when it has to be signed. So let's say that, for instance, in Florida, Medicaid, it's 48 hours. So once the appointment is done, that intern has 48 hours to sign their note. So my concern was, does that mean that I have 48 hours to sign that note as well? So the answer was no. So once the intern has signed that, and I'm looking at it, even if I send it back for her to fix it, as long as there's some sort of internal log that she initially signed it within 48 hours, then we're covered.
Yeah.
Now, from my understanding, Medicaid will not be happy if it took me 2 weeks to sign it 2 weeks later. So you want to make it in a reasonable time frame, but that whole time frame starts and stops with the intern. And so again, you want to make sure that that is done before you're billing, because we also don't want to get into the headache of billing something that maybe as a supervisor, I looked at it and I'm like, oh, we can't bill this. Like this does not meet the criteria at all. And so if Annie's already billed it and I'm saying no, then we run into the whole issue of having to avoid that claim and try to get that money back. So we want to make sure that whatever your process is that all of your stuff is done, all the intern stuff is done before it gets to your billing. So the other part is liability insurance. And I had to do some research into this myself. So I always had assumed that if I have insurance and they have insurance, we're good to go. However, I learned that I have to also add them on my insurance. So make sure that when you are thinking about your liability insurance and you're getting quotes, that you're also going to ask, what does that look like if I add an intern? So that does sometimes actually make it, it significantly made mine go up. However, just make sure that you add them on there. And that does not mean that they cannot have it. They still have to have theirs as well.
And then also make sure that your amounts for your coverage meet your insurance company's requirements as well.
Yes. And so when we went to add an intern, one insurance company actually made me change mine to a higher amount. The other ones did not, but one insurance company actually did. So that's something that you definitely want to make sure that whatever amount the insurance, when you're calling them, whatever they tell you you need, that's the amount that you're going to need. So one thing that I think can sometimes be really confusing, and I know that Annie and I get questions a lot that we notice this, is that sometimes the state boards don't always match what the insurance company is also saying. So not only do we want to look at what the insurance company guidelines are, but we want to check our state boards behind us as well. So for instance, I think Florida just passed the law that we can do telehealth, but some insurance companies are still saying, no, the insurance can't do telehealth. So sometimes you're going to get conflicting information. This is, and I know for us in Florida, I literally email them and just say, hey, here's my questions. And then they just answer me right back. They're great. So I would make sure that you are going on there, and they all, and most states have a section, they actually call it registered intern, and they have the criteria right there laid out for you. I know Florida is updating theirs and changing theirs right now. So if you're in Florida, you might want to check into that. About the certain guidelines. So just make sure that we're keeping up with not only the insurance guidelines, but we need to follow our state boards for our scope of practice.
So I know there's been a lot of what from the intern do I need to give to the insurance companies? Basically nothing. As long as you have your internal documentation. And when you think about it, one rep kind of explained it this way, basically the only information you're ever going to give to them is someone to be credentialed with them. For someone to meet the requirements for incident to billing, they do not meet requirements to credential. So it kind of makes sense when you think about it that way. I would make sure when you're calling those insurance companies, that you're definitely asking that question. But the ones that we have checked in with, if you have your internal documentation, the claims are not going to reflect any information from the intern, so they don't need that on their system, for anything. But I would just make sure that you're checking with them. They may just want, a copy of their registered intern license. They may, want a copy of their liability insurance. But I would just kind of call and check that. The ones that we have looked at and the ones that we've credentialed with do not require that. They require us to keep that on hand, but not for you to send that to the insurance company.
Yes.
No. Okay. We've got something for that. So I know that's been a lot.
We want to do a little bit of questions before we give a little. There's one thing though that before we do a question and answer, there's one thing that I did want to kind of also note is on that consent form, which you guys were going to get, and I don't think I mentioned this, is that make sure that your client also understands that for whatever reason, if you bill that insurance and they swap insurances to an insurance that your intern no longer takes, then they're going to be responsible for that amount of money. So let's say that, Annie's my intern, she's seeing a Medicaid client, and then they switch off of Medicaid to Blue Cross Blue Shield. Well, in Florida, I cannot bill Blue Cross Blue Shield for Annie, even though I am credentialed in Blue Cross Blue Shield. Annie is not, and they do not allow incident to billing. So that now becomes the client's responsibility to pay for. So when you're thinking of your consent forms and however you guys check your insurances every month, which we definitely encourage you to check them every month because clients always forget to tell you, make sure that that is some sort of understanding that if that were to occur, what is going to be the plan? Do they swap to self-pay? Do you refer them to a clinician that can take their insurance? But ultimately they are responsible for that amount.
Yeah, and also, and making them aware of what those fees are. You know, like if you choose to switch, if you just really want to stay with your clinician and you switch to an insurance that they cannot take, this is what, you know, you run the risk of doing. If you switch to something and you can't afford that, you know, do we refer out? Would you like to see another clinician in our practice? Just kind of going through and having their signature on it, you know, so then it helps eliminate some problems later down the road.
Yes. And then again, just really quick, I just wanted to say, kind of from a supervisor's perspective, when you're thinking about this, understand the liability is on you. So when you take on an intern, the insurance company basically has no idea that you have an intern. What they see is you. They see your name, they see your license. And I know all of us have worked very hard for that license and we all want to keep it. And so understand like what happens in those sessions, that is definitely your liability. So I always encourage anybody that's going to do supervisory and have interns to make sure that you really have an intern that you feel comfortable with. And by that, I also mean that you can talk to, that you can check in with stuff, that it doesn't feel like a fight every time you're trying to talk about things. And that you know that they'll come to you when they have questions, when they have concerns. The other part that I really want to also kind of emphasize is it takes time. So I know sometimes it's, you know, for me, when I took interns, we're in a rural part of Florida. We don't have resources. And so for me, it was like, I really need therapists because I cannot see 70, 80 people. Like, I don't know what to do with all these people. And so for me, I really wanted to bring that person on to help. However, I did not account for the time that it also takes. So even if my intern seeks their licensing for the board supervision somewhere else, I still have to have that time in my agency to make sure that I'm reading their notes, that I'm giving them feedback, that I'm there for a consultation, that I'm there if they need feedback. And I think sometimes you don't realize how much time that can take. And so a lot of times, some of these interns are literally just walking out of school, and some have had little exposure and some have had a lot. However, they're still literally coming out of school and are going to have questions, and that is really just going to take time. And then again, I think coming from the intern's perspective, you know, the other part is I really encourage my interns to make sure you learn the CPT codes and you know what is happening in those sessions and what you're supposed to be doing. I think a lot of times as the intern, like, we're just sitting there and we come in with our notes, tell our supervisor, and we walk out. We have no idea the whole process that's happening. And I think sometimes when our interns can understand that process, they can also, as a supervisor, it makes me feel more comfortable that if there is a problem, they're going to know what the problem is and be able to come tell me about the problem. The other thing is make sure that when you're finding that relationship, that you're really thinking about, do we have like the same like ideas? Do we have like the same modalities that we're interested in? It doesn't have to be the exact same, but I'm not, you know, if I have somebody that's, you know, certified in EMDR and I've never done EMDR in my life, then that's going to be really hard for me to like kind of read their notes and make sure that they're on the right track. So I want to make sure that whatever my intern is doing, I understand what my intern is doing, and the intern understands what I'm doing, and I can provide that feedback.
And I think a lot of it is, you know, from an intern's perspective, you know, especially in our area, you know, Donna was saying we are very rural and there aren't a lot of options. You know, really looking at what your ideal client needs to look like. You know, like if you are absolutely dead against, you know, seeing kids and you come into an agency that only sees kids, kind of working through some of that. I think a lot of interns kind of have an ideal client when they come in, and then they actually come in and start doing therapy and they go, oh, well, they're not so bad.
Yes.
I kind of actually like kids. And then, they go and get their certifications and a lot of that. So I think, having certain ideas set in mind, but then to also have that open mind to, and get exposure to those, it's very easy to say, I don't ever want to do that with not having any experience working with that. And any sort of trainings working with that. Now, if you've done that and, you have your time and you say, yeah, that's not for me. I think everyone, needs to have those options, but I think having an open mind to, this is going to be different. I'm going to try it. I may actually do some trainings in that and to see, it may become your favorite.
Yeah. And I think, unfortunately, one of the downsides to the intern billing or incentive billing is that there are certain insurances that will only do that. So that may actually dictate some of your clients.
Yeah.
And so with that, I think that's also something to have that open communication with your intern, is that, I've had interns come in and say, hey, I want to work with this population. I want to be able to do this. And one, it's just not feasible for our area. Like that is not a population that our area really has a lot of. And the other part is certain insurances
Don't cover that.
And so making sure that when you're thinking of the intern supervisor relationship, that it is what kind of clients, what is this going to look like? What are your goals? And can I help facilitate those? Or are you open to try new goals? And if they're not, like, let's say they try the new goal and they don't like it, what is that backup plan? Because we've had that too. Like I've had clinicians come in and our population is mostly children, and they'll see some kids and say, I
Can't do it.
not want to see another child. And unfortunately, like that is all we have.
Yeah.
So it's like, okay, so what is that backup plan?
Yeah.
And as a supervisor, I think the biggest part for me when it comes to that situation is then what do I do with those clients? Because at the end of the day, those are my clients. And so I can't take on a 60-person caseload or a 20-person caseload if my intern just says, hey, I don't want to do this anymore. Like, I don't like this. This is not something I'm interested in. I think I'm going to go somewhere else. Like, so understand that those clients are also your clients. I think that's just a big thing to also remember. So I think with that, we can look at I think there's some chats we can look at. Let's see. Oh gosh. So we have one question that says, does a supervisor need to be one approved by the board or just an employer? For example, in Texas, you must be fully licensed for 5 years and get additional training to be their supervisor on record with the board. So is it a board supervisor or can it be an employer? And it sounds like it needs to be a board. So Ashley, that's a really good question. So for instance, you can actually have a board supervisor, so somebody that's supervising their license that's actually not with the agency. So like so for instance, like if I have an LMFT so somebody's working on their marriage and family license, I can still sign their notes as an employee. Like I can still sign them off in the agency and make sure they're following those guidelines, and that LMFT will get supervision with another supervisor. The only thing that I will add to that is make sure, like, I like to be in contact with that supervisor so that we are actually saying this, like kind of working on the same thing, because they technically cannot have access to my notes. So they that's our agency notes. And so for confidentiality purposes and things like that, I can't just hand them all of my notes for them to supervise their intern. So we have had interns that had supervisors somewhere else with the board for their licensing purposes. And if that is the case, I'm in contact with that supervisor. I hope that answered your question, Ashley. If not, pop on and tell me. Let's see.
Hey, do you guys want to stop sharing the screen so we can
Yeah.
maybe?
Yep.
Okay. Yeah. And as we said at the beginning, if anybody wants to unmute and needs clarification about these, feel free to ask.
Yeah. Please clarify. I can or cannot bill for a graduate student getting an MSW. So if they are still in school, insurance companies will not let you. Now, I don't want to say this to confuse anybody. So for instance, there's some insurances like Medicaid that will allow for certain billable services if they have a bachelor's degree. So so instance, let's say that I'm gonna do a group. And if I want to do a group and Annie has her bachelor's degree, but she doesn't quite have her MSW, Annie can run some of my groups based on that criteria from Medicaid, but Annie cannot do individual therapy. So you want to make sure that whatever you're billing for equals the credential that they currently have. So not what they're working on, but what they currently have. Yeah. Hope that if that didn't answer it, please let me know.
Can I just ask a clarification on that?
Yes.
Thank you. Oh, my camera's not on either. Sorry.
Okay.
I'm snacking.
You're good. We understand.
Yeah. So I'm in Minnesota, and when I was in my master's program as an intern, I am 100% certain that my agency billed for me. And I'm not sure if they were like legit or, just kind of worked around it, but I have an intern coming soon, and I want to know, like, how do I know this for certain?
So a lot of it will also require on what that organization, how they were classified with that insurance company.
Yes.
Mhm.
So like with Medicaid, if you are that, community mental health, they have a lot more workarounds than just a private practice.
Yes.
That's good to know. Yeah, they were community mental health, so that might be the difference. Okay.
And to be honest, community mental health gets away with a whole lot more than we can do in private practice. So that's something to always like keep in mind. Because I know for me, like I was trained in community mental health. So I'm like, oh, all of these rules. And then when I started to get into it, I was like, oh, no,
Yeah.
that doesn't apply to us. So that's definitely something that you want to question. You want to ask first.
Okay. But you are finding pretty confidently that as an intern in grad school, most insurances across the US are not allowing billing.
No. Like I said, the only exception would be is if there are some that will let them teach groups with using their bachelor's degree. So they don't really care they're working on their master's, but you can use it under their bachelor's degree. But even then you're going to want to call and ask because again, community gets away with more than we do in private.
Thank you.
You're welcome.
And Molly says, does readily available include available by phone?
Yes. So just make sure, you just want to make sure that your supervisor, that your intern can reach you. So, I have a whole system set up with my interns that they know how to find me. They know how to call me. They know how to get in touch with me if I'm out, like if I'm on vacation or I'm at the doctor's office and I can't answer the phone, like they know a backup plan as well of like, I have other licensed professionals in my building or in my office. And so they know who to call if I'm not available that they can also go to. So you also want to make sure, because I know sometimes we actually like to take breaks. We like to go on vacation. And so if that happens, make sure that your intern has a backup plan because they'll still want to be working. So make sure that there's a backup plan. What about in the case of somebody with an associate's license that owns their own practice that I'm supervising directly? I don't pay them and they have their own practice, but are directly supervised under me. So Darcy, I think basically what it sounds like is that you have an arrangement with them that technically you're the qualifying supervisor for their company. If that's the case, then as long as you're supervising them for their company, I would make sure that you have a contract that says that and is airtight and says that that is what that is with those requirements. Because technically, those are your clients. So whoever your intern is seeing is still falls underneath you.
There's Darcy.
Okay, there she is.
Did that make sense, Darcy?
Yeah, it's just, so I'm in Arizona and the board has recently changed their rules to allow associate therapists to have their own practice under direct supervision. So in a case like that, they're technically like an intern because I am supervising every aspect of their work.
Okay.
But they're their own person, so it makes it a little strange, but yeah, that did make sense. Thank you.
You're welcome. Yeah, in Florida, sometimes we've had interns that have opened up a private practice. And that's kind of the same way, is that just make sure that your contract specifies kind of like what you require, what they're responsible for. Because at the end of the day, you're still, those clients
Putting
are
your
still,
name,
yeah,
yeah.
those clients are still yours.
Thank you.
So let's see. So if I'm an approved social worker and I have a social work intern, I can provide insurance and bill insurance.
So I guess
Tia, do you
yeah,
mind
can you explain that a little?
jumping on for a second?
I just worded that incorrectly, but you answered that with my previous check-in,
Oh,
like,
okay.
can I bill a student? That's
Gotcha.
Okay.
Gotcha. Okay. Can the billing supervisor and the licensor be different? There are some providers who have outside license. Yes, they can. So for instance, like I have, so two of my interns have an outside supervisor because they're working on your LMHC.
LMHC, yeah.
And so they see for their board, they see them. And then in the agency, again, I sign all their notes. But then I meet with their supervisor.
Has to be available and not with the client.
Yes, supervisor can be, so yes, so I can be, so Jamie, just so everybody knows, asked, can you as a supervisor be in session at the same time as your intern? Yes, you can. So just know that if, you know, if Annie is seeing her client and she has, and the client is suicidal and I need to go do a suicide assessment, then yes, I have to figure out how to navigate ending my session and going over here to this emergency and handling that. Because again, I think it's trying to keep that in mind that your intern's clients are still yours. So when there's an emergency that rises, like you still have to be able to kind of figure out how to handle both.
So I think like with Jamie, to bill as an intern under a supervisor, the supervisor does not have to be in every session.
Yes. And I think, and we may have confused, and to kind of clarify, there are some insurance companies that ask for the intake to the biopsychosocial and that treatment plan to be done collaboratively. So that is that exception. Like there is some, I think it was Cigna maybe in Florida that has asked that the intern do those initial appointments with the actual supervisor in session.
And then once that treatment plan is set up and those, you know, like therapeutic sessions start, that's when the intern can kind of take the lead and be just by themselves with that client.
Yeah.
Is that for Cigna everywhere or just Cigna in Florida? Just
I think that
curious.
was just Cigna in
In
Florida
Florida.
is what we
Oh,
called our rep.
wow.
Yeah.
Jeez. Okay.
Yeah, we were like,
Sorry, I'm just like, wait, I need to know more. Okay, I'm
Yeah.
butting back up.
So, so basically, if I understand it, somebody who is a student in a program is not an intern because they are a student. Is that correct?
Correct. Yes.
Okay, you can't be an intern if you're in a graduate program. You're an intern according to their program. But
Yes.
in terms of what you're speaking about, billable, we're talking about, you know, building a practice.
Yes.
Okay, that's pretty clear. Is there anything we can, let's face it, the benefit of having an intern is not only to teach, but to gain ourselves. Is there anything we can bill regarding what they can provide? Is there any service that they can provide at all that we can bill for?
So we're talking about like a student that's still in school.
A graduate student, yeah,
Okay.
graduate student.
So
yeah.
I think it goes, so one way to kind of think of it is you don't want to consider their degree that they're working on. So that they haven't really obtained that yet. So we don't want to consider that as
Okay.
their credential. So if we look at it from the perspective of what have they earned, so technically they have bachelor's degrees if they're working on their master's.
Okay,
And so
okay, got it.
some insurance companies like Medicaid will let bachelor's levels do certain things. Like they can run a group,
Okay,
things like that. So think of it from the perspective of what is the credential that they currently have instead of what they're working on.
okay. Are there anybody know of any other things that typically such a person could do through many insurance companies? I'm not aware of them. Maybe there are things other people know of, you know,
Yeah, for the most
that are
part.
billable. Uh-huh.
For the most part, so I do have actual student interns that are
Okay.
currently in college or like in the school.
Okay.
But I don't bill for their services. So they do things like when they sit in with me, like they'll help me write my notes. They'll do audits for me, like they'll go through my charts, make sure I'm not missing anything.
Okay.
So it's
Right.
kind of like that clinical admin type stuff
Okay. Okay.
that nobody gets paid for.
And nobody wants to do,
Right.
especially students.
Yeah. Well, and one thing that we have found with that is it's a fresh set of eyes. So a lot of times they do, like during those chart audits and our system audits,
they do stuff.
they find things that we've looked at it, you know, for months and wouldn't have seen.
Mhm,
And I
mhm.
tell them it's a great way to learn. You see what the chart looks like. You see
Yeah,
what it
yeah.
looks like.
Well, and you know, like a lot of
Right.
that, you know, we've talked about like the stuff that school didn't teach me, you know, a lot of that it's good exposure for them.
Yeah, yeah. I think so, but everybody wants to be a clinician, you know, everybody wants to get
I know.
certifications. So you know, all this other stuff is not the good stuff for them, particularly. Yeah.
Yeah.
Right.
Okay, so that's graduate students. What about people who are getting their doctorates? And I don't know. So I'm a psychologist.
Mhm.
People who are in doctoral programs in psychology. So you're basically saying we can go back to what they have previous. They would have a previous credential, master's in psych or what have you. And if they're doing postdoctoral, that means they already have their doctorate, but they need their postdoctoral hours. So we can bill. Whose name is on that? That's always been murky to me. They've got their doctorate, they're working towards their hours.
So they're not fully
They're not
officer.
licensed as psychologists yet,
Right.
but
Yeah.
they do have the degree.
Yes, but they have that. They've fulfilled their master's degree. So you can look at
Yes.
it from what can the master's level then do.
Okay, and if they've done their doctoral degree, but now they're postdoc hours, so they have their PhD or what have you,
Mhm.
now they're doing postdoc hours, so what can they do?
So again, I would look at it from that perspective of they're not off restrictions yet.
Okay,
So
so we're still signing for them,
yes.
essentially. Okay. Okay. Okay, so that would be the same as any intern who is doing hours, and we're signing off until they get sufficient hours for their independent.
Yes, ma'am.
Yes, ma'am.
Yeah. Okay, trying to think of other things because this comes up all the time. Okay.
And
Hi,
while
this
you're
is-
thinking about that, I wanted to say, Linda, you asked Blue Cross Blue Shield of Florida. It does not allow it. We cannot in Florida have
Do
incident.
what?
So
What we
somebody
can't do
asked,
in-
yeah, somebody said Blue Cross Blue Shield of Florida. You cannot
Yeah,
bill. You cannot, they
Can't-
don't do incident billing.
that you can't bill for what? I'm sorry, for incident 2.
Yeah.
Mhm. Okay.
This is
But other
Corey.
companies use.
Oh, I think I had Corey. Is that
Yes,
okay?
I just wanted to say I saw where another practice for their interns that were in school, what they wound up doing was not billing the insurance, and they wound up doing a sliding scale fee.
Mhm.
And I was like, oh, because I've been doing this wrong. So I was like, okay.
Yeah, I've heard of them doing a sliding fee. And I've also heard like if you can get grants. So a lot of times if you're associated with a school or you can get a grant that you can use them for as well. But in regards to insurance, it would be a no-go.
Yeah, and I think if you were looking at that, I would definitely make sure that that information is presented like from the beginning. You know, like a lot of people say, well, I have a high deductible, you know, can I just do something else? You want to make it very clear that like this will not impact their insurance at all.
Yes.
Like this will not impact a deductible. It will not impact an out-of-pocket max. But if they choose to do that kind of self-pay sliding scale that they are opting out of using their insurance.
And I think that's something that's really key to think about, is that, so a lot of times like we've had, and that's a different whole thing, but just real quick, if they don't have insurance, they say that I don't want to use my insurance, and then you've seen them 6 times and then they turn it into their insurance. They need to understand that once, if they're seeing somebody that is not licensed and they're actually in school, that cannot go towards their insurance. So we have them sign what we call an opt-out form. I'm opting out of using my insurance. But yes, thank you, Corey. Let's see. So I also have one from Lori. It says, is the modifier for the rendering provider or the supervisor? For Kentucky, we use HO for fully licensed and U4 for under supervision.
So the modifiers that are going on the claims, if you think about if the supervisor's information is on the claim, then that's reflecting them. So if you're using a modifier for supervision and they have a modifier, required for different credentials, then you would have to follow that guideline, if that makes sense.
If not, Lori, just pop in and
Yeah,
we'll come back. Tia asked, in your experience, is Aetna EAP also flexible? So I have not found an EAP that has allowed instant to billing. All the EAPs that we have, and we've taken quite a few, and even in our billing agency, we have other providers that we bill for, and we have not found one that an EAP actually did approve. And so I don't want to make that a blanket statement, because I know that there's like side EAPs that agencies can actually go make on their own with the direct company, and they may have different qualifications or requirements, but for the most part, EAP does not allow for that billing.
Sorry. Is that Cigna and Aetna as well? You can't do EAP?
Yes. So Cigna and Aetna, you got to be fully licensed.
Okay.
Yes. Does anybody have the requirement application process to get named as a community mental health agency? I do not have that.
I don't.
And the reason why I say that is because that's definitely state by state, and that is actually insurance by insurance specified. So for example, like Medicaid's requirements of a community mental health agency. So I'll use this example. Medicaid qualified us as a community mental health agency, United Healthcare does not. So that doesn't, just because you are with one, it can help, but it doesn't guarantee it. So I think Carrie asked, do you have updates on places of service? Does Kim have that?
I don't know. I know that, like, as far as
In Bill Like a Boss, we are keeping a list of who wants 10, who wants O2. Medicare still wants 11 and 95. As far as I know, that hasn't changed. But especially Blue Cross Blue Shield, you have to navigate to the homepage of Blue Cross Blue Shield for that state. And a lot of times they'll have a statement on the top, which modifier or which place of service they want you to use. So it really is different for every Blue Cross Blue Shield. I can't remember them off the top of my head, but in our Bill Like a Boss membership group, I've got a whole list with links to every insurance company that tells you yes or no. But for the most part, if you go look on their website, you'll be able to find that information, because some still want you to use O2. Some aren't even recognizing 10 yet. So worst case scenario, it gets kicked back. You just resubmit it with the correct place of service if they're not accepting 10 yet. But whatever one you're using, make sure your note matches like where the client was located. That's just like you want to say client was in car at the time of service, make sure the place of service matches.
Yes, that's huge.
But yeah, I don't want to get too off topic because I know we're not talking about
you're
that.
good, you're
Yeah.
good.
yeah.
Just a quick little.
Yes.
Okay.
So I think, Heather, you had asked that you had an intern that was working for you under the limit license and they did not pass, but she still has her LLBSW. Can I bill an incident to billing? So the one thing that I'm going to say is I would definitely check. That's a question for your board. Like I would check the board of Michigan. And the reason why I say that is because even recently in Florida, like they've changed. So there for a long time, the answer was, hey, as long as they had the MSW, you could do it. But now the board is the one that's saying that there's a time frame on that registered intern. So I would definitely check with your board to see what their guidelines are as to what their scope of practice is now when that happens, because again, like that just keeps changing. There was, just to clarify, you cannot bill for an intern who's in school, right? And then, is there someone who can help me get started to set up? Seems pretty intimidating. So Danita, yes, you can reach out. We offer different types of services, and we can see if we can help you with that. Yes, the billing and all of this and credentialing can be so overwhelming, which is why we are doing this and started our practice. And you can also reach out to Kim Tolson, because she has a great Facebook page that has lots of resources.
Yes, and it's super helpful.
Yes.
Thank you. Yes, and I just dropped Annie and Donna's website in the comments if you guys want to reach out to them. And we do have the Bill Like a Boss membership that all three of us run together, and we have live meetings just like this, where Annie and Donna are in there answering questions once a month for an hour, and I have an office hours too. So, side note.
Yeah. So backup plan for when the supervisor is not available for some reason. Yes, so the backup plan is just somebody that's qualified. So as long as they're qualified in regards to like their license, they can be your backup plan. And then let's see, in Oregon, we have similar rules to Arizona's, but insurance company said we cannot bill unless they are through our company. So that is definitely, so Dr. Sanderson said, in Oregon, we have similar rules as Arizona's, but insurance company said that we cannot bill instant for them unless they are through our own company. And that was where we were saying, like, make sure when you call those insurance companies that you make that those are those questions that you're asking. Like, what does that look like? Do they have to be in my office? Like, can they be in the across the room office? Like, what does that actually look like? And so, yes, there are some states that say that the supervisor that's signing has to be part of the agency. And again, a lot of people that work around with that is that they do a contract with them and they say, I'm paying them a consultation fee or whatever that looks like. So that would definitely be something to ask an attorney for, but also make sure that the insurance companies, you're meeting that criteria.
Have to leave.
Can it be a 1099 or does it have to be an employee? So this was like a huge controversy about did we have to make an intern an employee or could they be a 1099? And so after lots of research and talking to attorneys and CPAs and all kinds of random people, there was not a black and white answer. The answer that I got was, yes, they can be a 1099. However, just make sure that your contract is airtight. And basically what that means is that you're outlining what you're responsible for, what they're responsible for, that there is some sort of emergency backup plan if they need that. And how the documentation is going to look. So, and the reason why technically when all of that came out is the argument was that they said they couldn't practice independently, but that doesn't mean that they didn't have a supervisor somewhere else. And so they could have a supervisor across the road and 1099 with me. And so they're still
covered. Yeah.
Sign for them. I had an intern last semester and did pro bono services or private pay because I didn't see anything that said I could bill for a master's level student. However, I guess I should look into community mental health clinic standards. Is it really hard to convert your private practice to that level? And is it only for Medicaid? So the answer is no. Different insurance companies actually have their own standards for what a community mental health is. Kind of like our slide that we talked about, how Optum said that we could be a community, like their thing was, are we rural or things like that? So, or do we have so many providers? So it's not just Medicaid, they can have different requirements. And so then the other thing is sometimes when you're looking into community mental health clinics, sometimes, some of the requirements may be that you have to have a med management person on staff. So there's just different levels of what they're expecting when they're thinking about community mental health clinics.
Yeah.
Yes. I must have missed the question regarding students. I have master's level student interns in my practice. Can I bill for them under myself when they're doing their practicum internship with me? Gotcha. And actually answered it.
Yes, disregard my previous question.
And then, Kim, they're asking questions about the recording. Do you want to answer that one?
Oh, I don't see that.
I think it was the wellness counseling.
Wellness counseling. Oh, I don't know why I don't see that one. Oh, well, I'm guessing that this started at 10 a.m. Central. Is that right? We came in late. Will this be recorded? Yes, after this is complete, we're going to email you this. Annie Donna's resource guide, like it's walks you through what questions to ask the insurance companies and also their consent form for interns. That it's like a template. So I dropped them in the comments here, but we're also going to email that whole package to you if you signed up for it. So you'll be able to get the entire presentation. Are there more questions?
You mentioned getting the community mental health certification. How do you do that for Michigan?
I think it goes back, Corey, like to the insurance companies. So you would want to, like, if it's a Medicaid, you definitely want to reach out to Medicaid and ask them their requirements. And then go back to like whichever insurance. So like United Healthcare, Blue Cross Blue Shield, they have different requirements per insurance company of what that really looks like. So I have some that require a med management person on staff, and we have some that just we needed so many therapists on staff. And so that would be a good question for your rep. For your insurance company.
Someone asked about Blue Cross Blue Shield of Texas. They've gone back and forth. They did, I think it was in 2020, maybe discontinued incident to billing, but then they actually reversed that decision. So as far as I know, they allow incident to billing as long as you meet their requirements.
And I think it's, I will say, I think from the billing perspective, like we've had a lot of concerns about reaching Blue Cross Blue Shield of Texas.
Yes.
So I definitely, if you guys can find a rep, I would definitely want to confirm that with them, just because even when we were doing the research for this as well,
it's hard
it
to
was
find
hard to find clear for
answers.
Texas. Yeah. So we definitely hear you guys on that one.
Can I ask, could you talk a little bit more about what it means to be an on-site supervisor in the day of telehealth? Like if we're all working at the same practice, but maybe we're all working from home at this time, does on-site mean maybe we should all go to the office and do telehealth from there so we're across the hall? Or somebody had mentioned phone. I appreciate
Yes. So one of the things, and that was a good question. So this is where also I was saying a lot of times we're seeing a conflict with your board versus like, so what the state is mandating versus what our insurance companies are mandating. So for instance, there was a requirement that if an intern was doing telehealth, I literally had to be in the same building. So I could be in my office and they were in their office and we could do it that way, and that's fine. But then there was also a time where it was like, okay, they couldn't do it at all. And then it went back to some insurance companies and states were saying that you could. However, the supervisor you had to be able to call them immediately and they could get to you or help you. And then some were saying as long as that you had a plan documented. So that is, I would definitely first start with your licensing board and see what their requirements are first and foremost. And then I would go to whatever insurance companies that you will be using and see what their handbook says.
Thank you.
You're welcome. And Lori, sometimes, depending on your state, associate level interns, sometimes they get interchanged.
So what we found, Lori, with like the associate levels was basically anyone as far as that has graduated that did not meet the credentialing requirements yet. So, like a lot of times one of the reps stated that they had seen, some groups say, well, I have, I'm licensed and Donna's licensed, but she just doesn't want to go through the hassle of, trying to get credentialed. I can't bill for her. But if she is in that intern window, she's working on her hours, she's graduated, she has her registered intern status, then that is that associate's level. She can bill under me.
Yes. So we have one question that says, if your EHR does not allow interns to sign first, does the supervisor need to sign within the 48 hours? Is that the time frame for most insurance companies? So the way that we were explained, so I have seen anywhere from 48 to 72, and that's usually written out in your contract of when it's supposed to be signed. And technically it's the signature of the clinician or the intern, I guess in this case, the person doing the session. So whoever's doing the session needs to have that signed within that time frame.
So it may be like with your EHR that you just have to adjust maybe how you have them listed to allow them the opportunity to sign that note.
And I've seen some, and it's kind of a pain, but like we've seen some that have figured out ways to like download it and then have the sign it and then put it back in the electronic health record. So you just want to make sure that the intern who's doing the session, that their signature is on there first within that time frame. Did that answer your question, Madeline?
Yeah, it did.
Okay. You're welcome.
Yeah, I know there are a couple of workarounds. Some of them are a little bit more headachy. You have to download and then you may DocuSign or something like that, but there should be. What EHR are you using?
I use Theranost.
Okay.
Okay.
Yeah. And it may even be something that you can reach out to them and just, if there's a way to adjust how she's or how that intern is listed in there, you may can grant them access to sign that, or it may be something, like Donna said, that you have to download, sign, and then just upload back within that time frame.
Yeah. Trying to make sure I didn't miss any, but I know, is there, let's see, I don't think I'm.
Yeah, if we missed any, just feel free to.
Was there one about physician billing? Did y'all answer that one already? Did I miss that? It was back near the beginning. Somebody said, will you be speaking all about billing under a physician? But now I can't find the question.
I don't see that one. Do you know whoever asked that one? Can you jump on?
Trying to find it.
Yeah, it took me a minute to figure out how to unmute, but
I think I saw it, but I can't find your question now. I think that's what you said, right?
yes, I did have, I was hoping that y'all would talk specifically about billing under the physician as an incident too of that service, of the physician service.
Are you talking about like a medical?
Right, like where you have different continuums of care, more like an agency of where you have a medical director, then you've got somebody doing medication management, you have somebody that's doing therapy, you've got somebody that's maybe checking blood pressure and ordering labs, things like that.
So I think to kind of answer that, so for us, like we do have a medical director and we have a psych nurse practitioner. However, I think it also kind of goes back to, I'm not sure what state you're in, Molly, but it goes back to
Georgia.
Okay. So I know like in some states, the nurse practitioners can actually work solo, like they don't need to be billed under the medical director. I'm pretty sure Georgia and Florida are the two right now. There's quite a few. They're moving along with that with med management and nurse practitioners. So that would definitely, for us, how we did that was that we went to the board and asked, okay, what's the criteria for for our medical doctor? What does he or she need to provide services for the psych nurse practitioner? And that was before Florida allowed it. Now they do. So our psych nurse, she's bills,
autonomous.
Yep, she bills on her own.
Okay. In a situation to where because I'm sure everybody's experiencing this, but insurance companies are taking a lot longer to credential people. Before the pandemic, it was like 90 to 120 days, and now it's like 6 months to a year. So is that, you talked earlier about a case by case basis. Is that something that you would need to go to your insurance rep and say, I have someone new coming on? However, I know it's going to take a while to credential them.
Yes.
So, and I would also, when it came to that, you have someone new coming on that's fully licensed, that meets their criteria, then that kind of negates them from the incident to billing. So if you have someone new who says like they're an LMSW or they're an LMHC or they're an LMFT, and they're just joining your practice or your group as a licensed clinician, which with whatever it is, a lot of that we found is just that waiting period. If they meet the requirements, they're just not credentialed yet, they cannot bill under anyone.
Yeah, unfortunately you have to. I will say though, I think the biggest thing with credentialing, and I think one time we may do one on credentialing, is that follow-up is key. Like that constant calling them and calling them and calling them, that is key. I know it feels like we're overwhelming them, but that is key to push that along. Otherwise it will literally sit there and then they're like, oh, well, nobody called it, or we called you, even though I don't know that they did.
Yeah.
And then they just end it.
They close
it and you have to start over.
Okay.
And now a lot of times, Molly, when you are doing those credentialing applications for that and you have a need, like you have a group or you have some that have patients kind of following them, if you submit that documentation with your application, then you're that much more successful in trying to speed that along. Sometimes it doesn't work. They say you have to wait like everyone else. But if you do have some of those extenuating circumstances, I would definitely put that on your official letterhead, submit that with it, and then in a week call and say, hey, do you have this? We have this population waiting. We have this population of your members waiting. What can we do?
Yes.
Okay. Because we are located in a federally underserved area, and right now there's practices that have like a 2-month wait to get into therapy. Nobody's able to call and get into therapy. So
yeah, we understand that.
Yeah, and that was one thing that when talking to some of these insurance companies, like some have conflicting information. Like Aetna and Cigna are pretty lax in that because they see the lack of people who are licensed, who are credentialed, who and they see the need for these services. Whereas United is kind of like, nah.
okay.
So definitely, we appreciate every one of you and like the questions, and we hope that we were able to kind of give you a good foundation to kind of start with and to run with.
And to think of, if you're thinking of starting this.
And we again, Kim Colson and us, we're here. If you guys need us, we'll do some more webinars in the future. So also, if you guys have some good ideas or some things that you're definitely struggling with, or you want more information about, please let us know.
Yeah.
I get it. I was there. I needed help.
And if you missed the beginning, our contact information is at the beginning. So once this recorded, session goes out, our phone number, our email, our website is there. So definitely feel free to reach out to us or to Kim. She has a wealth of knowledge. So
thank you. Yeah, thanks for coming, everyone. We should get this out probably in the next 2 hours, I would think, to your inbox. So it'll be there shortly. And also, again, Bill Like a Boss is our membership that the three of us run together. Annie and Donna do the billing part of it. I do the office hours and also answer a lot of questions in there as well. We have a private Facebook group and 3 live meetings a month for support. So hope you'll check us out. And thanks, guys. Thanks, Annie and Donna. I appreciate you guys being here.
Thank you, guys.
Bye, guys.
Okay. Bye, everybody.